Thank you so much for giving me the opportunity to talk to all of you. The last time I spoke to CLL, I actually didn't speak to you, but we did a webinar, wasn't it, Nora, during COVID. And that was a taped one. So it's really nice to see all of you. And actually, I'm more at home with face-to-face, but I do a lot of my sessions on Zoom now since COVID. And so I'll just tell you a little bit about myself. I'm an occupational therapist. And I specialize in mental health and well-being. My last post in the NHS was a long time ago, is when I first had my oldest son, and I was head of the mental health unit at Chase Farm Hospital in London. And so I'd since given up work. Between Samir and I, we have 7 children. So now so I now have my own practice, and I'm an acceptance and commitment therapy practitioner. And I've become involved with CLL. It's through Samir, really, because he hears me talking about the work that I do, and he said to me, "Can you do that for my patients?" And I said to him, "Yeah." So he sometimes refers people to me. And I think Michael O'Neill one day mentioned to Samir, we'd like to develop this web-based support, around acceptance and commitment therapy. And he said, "Oh, my wife does that." So it sounds like we have a monopoly of looking after people with CLL, but it's a pleasure looking after all of you. So I have come, I'll just give you a little bit more what I do. So I do have my private practice. I also volunteer as a bereavement therapist for Cruise Bereavement Care, and I look after the children and adolescents there. I'm also a trained emergency responder. If there's like a terrorist attack or anything like that, I get involved giving emotional support. So the last time I was involved was the Grenfell Tower. So I had to give support to the children there, and also COVID-19, the latest pandemic. So for this morning, I have come here to give you a little taste of what ACT is about, which is also known as acceptance and commitment therapy. So it's a form of behavior therapy. I'm sure you've heard of cognitive behavior therapy. So it's a more it's a kind of updated version, but it's completely different from CBT, which is what they call it. CBT changes your thoughts, whereas acceptance and commitment therapy doesn't ask you to change your thoughts, but to accept the thoughts that you have and the feelings that you have. So ACT is actually where the support ACT, I don't know if some of you are familiar with it, is the web-based support that I've developed for the charity. And it's, some of you may have heard of it and some of you may not have. And so I'm going to run through a few exercises with you today, just to give you a little flavor of what ACT is, okay? So what is ACT? So what I'm going to do is I'm going to ask you a few questions and just have a little think, okay? So how is life going for you? You've been through a difficult time and you're trying to recover, or you're trying to cope. You've been trying to find a sense of meaning, purpose, enjoyment, or fulfillment in your life. You're feeling dissatisfied at work and or with your relationships with friends, your partner, or your family. You're feeling a general sense of unease, as if something is missing. You've been feeling distracted or preoccupied by worries or other repetitive, troubling thoughts or memories. Your life seems controlled by anxiety and a host of associated unpleasant physical sensations. Your anger, sadness, fear, or other strong emotions seem to be more in charge of your life than you are. You notice yourself spending less and less time each day doing the things that really matter to you. You're lacking motivation, energy, or enthusiasm to get stuck into an aspect of life in the same way that you used to. So does any of that resonate with any of you? Yeah? Okay. Yes, no? Yeah. Yes. Good. So in front of you, I've put some beads. So I'd like you all to take 3 each. Just 3 beads each. You all ready? Okay. You all got your 3 beads? Okay. So, because when we struggle with our thoughts and our feelings, it sometimes is like a circus act. So I'm going to ask you to just take 1 bead and juggle it from one hand to the other. Yeah? Yeah? Just juggle it from one hand to the other. Yeah? Is that easy? Yeah. Yeah? Okay. Can we add 2 now? Can we have 2 beads now? Can you juggle 1 bead, no, 2 beads now, and see how easy that is? Huh? Are you dropping your beads? It's only 2. Huh? Right? Right. Can we try with 3? Sure. Yeah, try with 3. Right? Anyone managing the 3? No? Okay, we'll go back to 2. Can you just do 2? 2. Try 2. If you can't do 2, try 1. But 2, better 2, because I think it illustrates what I'm trying to explain. Try to juggle 2 beads, okay? Right. Okay. The next bit is a bit of fun, but if you can't do it, it's okay. But what I'd like you to do while you're juggling, I haven't said stop juggling. Please carry on juggling. You've had your coffee, haven't you? Right, okay. Now, juggle, juggle, juggle. Now get up while you're juggling. Get up while you're juggling and carry on juggling. Yeah. Juggle, juggle. Yeah, you're doing it? Right. I'll let you get your rhythm a little bit. Yeah? Okay, now, while you're up and you're juggling, and some of you dropping your beads, right? Yeah, some of stuff, don't stop, just carry on juggling, yeah? I'd like you to pretend you're hula hooping. Right, let's see. Can you do it? How easy is that? Right, okay, I can hear you. Right, you can all stop and sit down now. Okay, was that easy? Was that easy to do? So the thing is, you cannot concentrate at all. Yeah, doing one thing is easy, but juggling a lot of things is really difficult. So after a while, it restricts your movement, and what happens? Everything comes crashing down. Yeah, and so something that started out as something really simple and harmless becomes really impossible to keep up. Okay. So my question to you is, do you stay with the bind of the struggle, the juggling ball act, or are you open to something new, which is acceptance and commitment therapy is all about? So with acceptance and commitment therapy, you will learn a different approach to living, one that offers a way to live in an engaged and meaningful way, even if tough things are going on. So we are naturally geared towards, when we have problems, we are geared towards the fix me or the control agenda. We want to be in control. Who doesn't want to be in control? And when we're like that, sometimes we find that life actually becomes unworkable. So through ACT, I call it ACT, you will learn a different way to respond when these difficult thoughts, painful emotions, and memories and experiences and uncomfortable sensations are coming to you, so you can respond to them in a different way. So to give you a feel for ACT, I'm going to do another exercise with you. Okay, with this one I have to say, because I experimented with Samir and he was whinging the whole time. Okay, and so what I need you to do is please follow my instructions. Do not do anything I haven't said. So if I haven't asked you to drop your hands, don't do it. I will tell you when to stop dropping your hands, okay? Okay. So, right. Okay, you ready?
Yes.
Okay. So, I'd like you to do this with your hands. Okay. So, in these hands, represent the difficult thoughts, painful feelings, the uncomfortable sensations that you may be experiencing when you've been diagnosed or when you're going through a treatment of CLL. Okay? And in front of you is me, and I represent all the things you love, the people you love, yeah? And the things you love to do. And at the same time, next to me, are the things you also don't like about your life, okay? So what I'd like you to do is, can you slowly, please put your hands in front of your face, right? So it's covering your face. Right. Can you all see me? Why not? Hang on, don't take your hands off your face. Okay, why can't you see me?
The trouble.
Huh?
I'm blinded by my
By your hands.
thoughts.
Yeah, right. Yeah, sit right in front of you. And if I were to ask you without moving your hands where they are, can you scratch the back of your head? Why not? Why? Why not? Yeah, because your hands are there. Okay. So, I'm sorry, I've just been told there's an emergency. You need to leave this room. You think you can all safely leave this room the way you are? Huh? No. Yeah. What will happen if you did that? You're going to get in trouble. You probably break something. That wouldn't be good. Okay, so then you realize this is not workable for me. Yeah? And so you're going to go, okay, I can't just be overwhelmed by my painful thoughts, feelings, and all these uncomfortable sensations. So I'm going to push it away from me. So I now want you to push your hands right in front of you. Yeah? As if you're really pushing it away from you. Yeah? At eye level, please. Yeah? So you're pushing it away from you. Okay? I want you to maintain that tension on your arms. That you're pushing it away. Push away. Oh, okay. Push away. Eye level, in front of you. Yeah? Right. So now, if I'm the person you love and I'm sitting in front of you and I want to chat to you, is it easy to talk to me? No. Okay. And if I asked you, can you scratch the back of your head? There's an emergency now. Can you all leave this room? Yeah, you can. You can. It's not bad. Yeah? Okay. Well, I was thinking we might stay like this for the rest of the time. What do you think? Huh? Why? Your arms are getting tired. Anyone else's arms getting tired? Are you all okay, or is it just Kate? You're all tired. Okay, you can put your hands down. Okay. Right. If I was your favorite film and you were watching me, can you enjoy me a bit more? Yeah, now you can. Okay. Can you scratch the back of your head? Right. There's an emergency. Can you go leave the room now? Safely as well. Okay. So, so what has happened to you is you are trying to control something, and your efforts to control it is actually stopping you from doing the things that you need to do and engaging with life. So your hands and feet is just a metaphor that I use for the things that you need to do to make life work for you and make you get on with life. But when you become so wrapped up in them, caught up in them, you can't do anything else, and that's all you think about. And so your efforts to control and sometimes to eliminate the pain, which is sometimes what we do, we try to push it away, may not only be ineffective, but can cause problems to you. For example, trying to leave the room with your hands in front of your face. And they narrow your options for you. And the thing is, our natural tendency is to, when we have emotional problems or emotional things that we are dealing with, we try to solve them. Like we use the problem-solving approach. Yeah, I'm going to try to push it away. It's almost like, oh, if I don't like that, I won't look at that. I don't like that speaker there, I'm going to move it somewhere else. It works for problems that are physical and what they call outside the skin, but when they're emotional or psychological issues, it doesn't work. Because they cause more problems for us, they undermine your own ability to take helpful action, which is to shift the focus from solving your problems to instead to acknowledging that you have these experiences and acknowledge them openly, to look at them, to explore them, and to also explore the other options you have in responding to your difficult circumstances, which Kate has actually beautifully described in her story. So we have the ability to choose how we respond and to discern which response may be better suited to the situation we're in. The pull of control wants us to launch into problem solving. And although they make you feel better in the short term, what happens in the long term? Yeah, these problems will keep coming back. These experiences, we are humans. We are going to have very difficult thoughts, feelings, and emotions as we get through life, and we will have challenges. And so what happens? If you are not flexible enough in your responses, life begins to shrink for you, and it becomes unfulfilling and less meaningful, because we do less and less of the things that matter most to us, because we are so caught up with struggling with the painful thoughts, the unwanted feelings, and the uncomfortable sensations. So looking at the habitual ways of how you respond to these unwanted thoughts, difficult emotions, and uncomfortable sensations are what we call these are the autopilot behaviors you have. So we have our set responses as human beings when something difficult happens. That's how I respond to it. And sometimes we're not very conscious of it. We just do it automatically. But it's really important to recognize what are those autopilot behaviors that we do, because sometimes they don't actually help you. So how are we going to do this? It's through mindfulness. So ACT is a mindfulness-based intervention. Mindfulness is a skill that helps you pay attention in a particular way. So it helps you not get caught up with the internal experiences, so you can respond more effectively to the challenges you are facing. So it asks you to be present right here, right now. Because when you're in your thoughts, where are you? You're in your thoughts. You're sometimes worrying about the past, or you're worrying about the future. You're never here. And then you realize, oh, where was I? So it asks you to be present right here, right now, with the attitude of openness, even when what you're experiencing is unpleasant. That's really important. So mindfulness will help you notice the thoughts that are showing up and the emotions and the physical sensations that are there. And regardless of what you're experiencing, it helps you to simply notice it and hold your experience, and helps you to choose to drop the struggle with them and accept them for what they are. So we are now going to do a very short mindfulness exercise. So I'm going to position you all. Okay, are you all happy to do that? Okay, so if you can uncross your legs, please. And if you sit with both feet, I'm used to walking around because I'm used to being with, so if you sit with both feet on the floor, yeah, and I'd like you to with your hands on your lap, and I'd like you to imagine someone pulling you up like a string on the top of your head, and then they drop it. So you're sitting erect, so away from the back of your chair if you can, please, because it helps with the breathing. And if you can imagine, you're sitting upright, but you're relaxed. Your shoulders are relaxed, okay? You're ready? Okay, when you're ready, please close your eyes. Or if you feel uncomfortable with closing your eyes, I'd like you to just have a soft focus on something. Okay? So I'd just like you to focus your attention on the sensations involved when breathing in and out. Simply bring your attention to noticing how the air feels as you breathe in, and how cool it is when you breathe in, and how it is a bit warmer as you breathe out. Focus your attention on that along with the sensations in your chest and your abdomen as your diaphragm and muscles help you to breathe that breath. Try for a while to only focus on your breath, including the sensations and rhythm of your breathing. Just tracking one breath at a time as best as you can. During this exercise, your mind will almost certainly wander away from your breath, and this is entirely normal and expected. It is normal for our minds to wander. Simply notice the thought that is entering into your mind. Don't try to change it in any way or push it away. There's no need to get caught up in the thought either. I'd like you to just simply acknowledge it and gently escort your attention back to focusing on your breath. I let you carry on for a few minutes and notice the kind of thoughts that show up. It's common for your mind to be distracted by thoughts. Every time your mind wanders, simply notice the thought that's entering your mind and bring your focus back to your breath. When you are ready, you can open your eyes and just be aware of the room around you and welcome back to the room. How was that? Thank you. So, did you notice the thoughts that were coming in and out of your head? Yeah? Was it easy to stop the thoughts? Was it, and focus on, not stop the thoughts, but let them come and go and just focus on the breath, or was it really hard to focus on the breath and not kind of get caught up in the thoughts? It's hard. Yeah? Yeah. It's very hard because our natural tendency is to focus on the thoughts. One of the things that our mind does is that the brain tries to protect you and try to help you. So when it can feel that you're going through a difficult time, it will give you thoughts and feelings that will make you act. But sometimes these thoughts and feelings are not very helpful to us, and they actually paralyze us, and they don't make us do anything very meaningful or very helpful to us. So it's really good to do the mindfulness exercise that you will find in Support Act anyway. It's good because it grounds you, and instead of getting caught up in that emotional storm in your head and that you're feeling inside you, you are grounded and giving you space from those painful thoughts and feelings. I'm not asking you not to think about them. All I'm asking you is just let them come and go. It's okay to have them, okay? So when you put your hands down earlier, where were your hands? Did your hands disappear? Yeah? They were still there. So your problems don't go away. They're still there. Yeah? But you accepted that, okay, that's what it is, but I can still carry on living my life despite the fact that I have all these challenges that I have. So I hope that that has given you a little bit of a flavor of what acceptance and commitment therapy is and what the web-based support is all about. Alongside the Support Act, which I recommend for you to have a look at, there are going to be worksheets in it as well, that if you could use it when you're doing your exercises. Because these are things that you have to develop, because they are skills to develop. Because it's not a natural tendency to do this, but we are taking advantage of the neuroplasticity in your brain. So our brains are not set, no matter how old we are. We have a thing in our brain which is called the neuroplasticity. So it's a bit plastic. It can teach you a new way to respond to things. Get away from the autopilot behaviors and respond in a different way. But to be able to do that, you have to first be conscious, how am I responding? And then you then have a choice, how do I respond differently so that life works for me now, despite having CLL? So alongside with that, we're going to, I think in January, we're going to have drop-in sessions, which I'm going to lead twice a month, and they will be similar to this format. I'm going to do an exercise and we will be able to talk about it a little bit more. There's a tagline I think that I put, I don't know, maybe I said it in the video of the introduction of Support Act, in which I really feel with a lot of people that I've worked with through the therapy that I've given people. There was a lady, there's a referral from Samir, and she was being interviewed by the news. She had a really successful business up in Yorkshire. And they said to her, you know, would you have not wanted, you know, that was a terrible time for you, you know, being diagnosed with a blood cancer. And she said to the person interviewing her, I wouldn't have had it any other way, because it actually helped me discover so many things in my life and how to deal with challenges. And so I always say, this is the thing I always say to the people that I work with, is your diagnosis need not be a fight for your survival, but a revival of your life. Thank you. So I don't know if you have any questions.